Hello, I'm Fiona Lang-Sharp, IBCLC, and team member of Gold Lactation Online Conference 2013. I'm here today with Dr. Carmela Baeza, talking about her presentation titled Breastfeeding for a Planned Birth. Hi, Carmela, how are you doing today? I have a couple of questions for you, and I'd love to hear your answers. I'm excited to hear your presentation. So I was wondering, how did you become interested in this topic?
Hello, Fiona. Actually, it was because after a few years of prenatal breastfeeding classes, we kept seeing that our babies were still being supplemented after birth, and our mothers were still afraid of not having enough milk, and our classes were just not, they seemed not to be very helpful at all. So we thought, we have to do something about this to help the moms, especially those who are at high risk of being separated from their babies after birth.
Yes, it's a fairly common factor that you're going to see some separation in hospital facilities with mothers and babies, and this is obviously you you saw that in your moms and got started on this journey. That's wonderful. Also, I was wondering, perhaps you can now talk to the professionals out there. How will this presentation really help them carry out their work with breastfeeding mothers?
I think it might give them some useful tools to be more proactive in the way we help mothers, the tools we give to mothers before their babies are born, that will make them feel that they're going to do better after birth when the baby comes. There are very specific tools like especially expression of colostrum, what very, very simple handouts to give the mothers, and basically just, I would say, tools. It's going to give them really useful tools.
Yes, I would agree. It's just sometimes it's the simplest of tools that they need, but some tools, it always sounds like mothers are not getting just some simple tools and often left on their own. And I know that they crave them in their prenatal sessions. So that will be wonderful. It'll be great to hear all the things that you have implemented in your work. So, and lastly, I would just like to ask you, so what type of impact have you specifically seen in your clients by implementing all of these techniques and tools?
That we've had, and we've had in all these mothers no formula supplementation for their babies after birth, and especially what moves me is that all these mothers feel incredibly empowered and fearless those days after birth because they know that their breast is wrong. They have their colostrum in a bag that they bring it from home. So it's wonderful to watch them, really.
What a wonderful gift to give to a mother is the confidence. And it sounds like you've done a tremendous job in your own practice, is just giving those mothers the confidence they need and equipping them, to know how to hand express and, get the education they need ahead of time. So it really seems like, breastfeeding, a planned breastfeeding for a planned birth is definitely a very, very important tool for a mother in our culture today. Well, thank you again, Carmela. I'm certainly looking forward to your session. As I expressed to you earlier, I'm getting excited already. And for our listeners out there, you can hear Dr. Carmela Baeza's full presentation on April 24th. You can also find out more information at our Gold online conference online, where you'll also be able to look up our other speakers and their times and dates. World Lactation Online Conference 2013.